Hi there. So my name is Sascha Edelstein. I'm a gynecologist and fertility specialist based at Thrive Fertility in Melbourne's north at the Northern Private Hospital in Epping. Today I wanted to talk about the topic of egg freezing. So certainly this is a conversation that's coming up more and more for women in their reproductive prime who are wanting to preserve their reproductive potential now if they're not ready to build a family for future. Certainly we're aware of the fact that women are born with a fixed finite number of eggs and that this is declining through their reproductive life. And the woman in her reproductive prime, say between the ages of 28 and 32, may not be ready to build a family for various reasons and may then choose to store her own eggs for future use and then to come back to that at some time in the future when she is ready to build a family. When we're thinking about egg freezing, it's important to get an assessment of the individual woman's history, her medical conditions, her gynecological history, any underlying conditions that are going to be impacting her egg reserve, and then certainly to get an idea about her egg reserve. And the ways that we would do that will be looking at the so-called egg reserve markers. That is the egg follicle count or antral follicle count, the hormone AMH, and we sometimes use the baseline follicle stimulating hormone FSH to evaluate this. Egg freezing is the first component of an IVF stimulation cycle, and essentially what we're doing in that process is giving a woman hormones to try and make as many eggs as are available in a given menstrual cycle to reach maturity at the same time that we safely can. And typically, we're aiming to get somewhere between 12 to 16 mature eggs from a given cycle. And these can then be collected and stored, cryopreserved into the future. The number of eggs that a given woman may be aiming to obtain in order to have a strong chance or opportunity to achieve a pregnancy in the future will vary depending on her age and her gynecological history, but is probably somewhere around 18 to 20 mature eggs in order to give a strong chance to achieve a pregnancy. These eggs can be stored and then utilized at some time in the future when she's ready to build a family. I think the things that are important to emphasize is that stimulation and treatment is not the same for every woman. Egg reserve is not the same for every woman, even women of the same age, and that eggs that are frozen are not a guarantee, rather an opportunity that can be utilized. I think that whereas egg freezing does offer women more control of their reproductive planning, they should also not forget about these eggs and rather revisit their intentions from time to time, because if they wait too long, their reproductive potential may shift away. Anyway, these are conversations that I think that can be had in more detail in a personalized way if you were interested to have a consult.